Vaccination, as you know, has been mandatory in India at birth for the last almost 70 years, since 1948. That is when it was started. 1962, it became a national policy, and everybody's been this thing. Now, one of the effects of BCG, apart from its protective effect on tuberculosis, prevention of tuberculosis, is its basic increase in the immunity, the innate immunity of a human being, of a person who gets this. And this increase in the immunity actually enables the person who's been inoculated to fight infections. And it has been known, it has been seen that it has it increases the immunity even for patients with virus infections, for bacterial infections, and this is actually what is being touted as something which is going to increase the immunity against the COVID-19 onslaught as of now. There is no definite evidence. There are studies. There is a study which is started in Melbourne in Australia, which is recruiting over 1,000 patients, 1,000 people, basically health workers who are working in a hospital in Melbourne, who have been injected with the BCG vaccine, and the results will be known in about 3 to 4 months, when we will be able to identify whether that is indeed helpful or not. If it is, it will actually be a boon for India, because we on our own have been inoculated with BCG vaccine, and this will be highly protective. There is definitely something else happening which maybe we haven't been able to pick up at the moment, but maybe it is the endemic malaria, maybe it is the rampant use of BCG vaccine, maybe it is the weather, maybe it is just the innate immunity of Indians. That is probably what is keeping the figures low, and I hope and pray that that is something, that the trend continues. As I said, there is an ongoing study in Melbourne and also in Netherlands, in which they have already recruited almost about 1,600 people, and in Melbourne almost close to 800 healthcare workers have been recruited. I think within the next 3 to 4 months, they will have some evidence which will probably tell us that the BCG is indeed protective, and it is actually supplementing our innate immunity and preventing the intensity of COVID-19. It's not that it's going to prevent you from the infection. It is hopefully going to reduce the intensity, which means that people, whoever suffer, will not have very severe symptoms and the severe disease. However, despite the fact that we are using BCG vaccines, it still does not deter us from social distancing and hand washing, which is extremely, extremely important, and that is something that we have to carry on for a very, very long time. In fact, for a long time to come. I think continue to do what you're doing. If you're staying at home, that is extremely, extremely important. If you do venture out for a little while, wear a mask. A mask is extremely important today, because it's not just the droplet infection that we've been talking about. There have been studies now which are telling us that there is this virus which can be actually floating in the air. So keep your fan open, keep your windows open, try and get a good ventilation in your rooms, wash your hands as much as possible, as far as possible. Anybody or anything coming into your room, which is your home, make sure that it is either very well sanitized or completely hand washed and soap washed, and that is something that is going to be protective. And of course, social distancing, keep a minimum distance of at least about 3 feet from each other, and this is something which will hopefully, along with the innate immunity given to us by the BCG vaccine that we've already been exposed to, and the fact that we are living in an endemic zone of malaria, this, and along with the factors that we enforce on ourselves, will hopefully see us through this epidemic. See, basically trying to improve your immunity is by maintaining good hygiene. I think that is extremely important. And having said that, because of the various pollutants in our environment, which we have all been exposed to, I think this is something which will and hopefully should increase our immunity. And of course, eat well, eat correctly. Do not expose yourself to too much carbohydrates. So proteins, fats and carbohydrates in the correct as a balanced diet. And of course, then there are some household remedies that we've all been exposed to. Turmeric, which is haldi powder, cinnamon, which is dalchini, and various other home remedies to improve the immunity, which most of us, ginger is again another one of these things. So using these as and when will hopefully be able to improve our immunity as well. It's an extremely unfortunate event. I see no reason for anybody to get physical. Even if you have a grouse, even if there is something that you feel is being done against you, you can voice your opinion. You don't have to become physical. We are in a civilized society. We are not animals. We are not people who are out on the streets. So we should be able to control our anger. And in this difficult time, physical violence or abuse is completely uncalled for, whichever community or sect or whatever it is. The fact is, we are all human beings, we are Indians, and we should learn to respect each other. And if somebody is helping us, medical healthcare workers are actually helping the community. And don't forget the fact that they are actually being exposed to this much more than you and anybody else is. We are constantly on the battlefront, we are right up there. So you have to make sure that, at least the least thing that you can do is to be respectful and not abuse or have any violent acts against them.